Hi guys, this is Drew Beard. I'm going to be speaking to you today about my health policy presentation, which is about the opiate crisis in the United States. Now, this presentation may be a little bit more different than the normal opiate crisis presentations that you've seen in the past, because while I do want to acknowledge the fact that the opiate crisis really is hurting Americans, it's hurting healthcare providers, it's it's hurting patients. Uh, what I wanted to speak to you today about was more about while we've acknowledged that this opiate crisis exists, how do we, from a legislative standpoint, protect providers who are wishing to respect the government's stance on the opiate crisis by curtailing back opiate prescriptions? How do we protect these providers from negative patient satisfaction scores and from the ramifications that comes from pulling opiate prescriptions back or dialing them back from the overall patient population? There isn't too much legislation that surrounds this because the big focus has really been on how do we curtail the amount of deaths that are related to opiates. Now, there are certainly a lot of deaths. According to a CNN article, there were 63,600 deaths in the United States in 2016, which averages out to roughly 115 opiate-related deaths per day. Other figures related that 29% of patients who were prescribed opiates will misuse them. We have so nearly 1/3 of patients who you write an opiate prescription for are going to use them improperly. So here we have a medication that's very high risk, Schedule 2. These medications are Schedule 2 from the DEA, and so they're going to be monitored very closely, and they have a high abuse potential. So, but we know that our patients need them, right? We have patients that have cancer pain. We have patients that name an injury, get into a car accident. We have patients that use opiate medications for a lot of reasons. And some of these patients have been on these opiate medications for a long time, years even. And so now what we have is we have a mandate from the federal government, a mandate from the DEA stating, hey, you as providers need to roll back the amount of opiate prescriptions that you're using and only use them for a certain type of patient and only for a certain duration. You can only prescribe so much, so often. Okay, great. That will hopefully help curtail the opiate-related deaths and poor patient outcomes that are related to opiate use. But wait a second, part of my reimbursement as a provider, part of the way that I make a living as a provider has to do with what's called patient satisfaction. The Centers for Medicare and Medicaid Services have patient satisfaction surveys. I'm sure you've all heard of HCAHPS. This directly relates to reimbursement for providers based off of patient satisfaction surveys. And a part of those patient satisfaction surveys is the perception of pain and the perception of how it was treated by a provider. This is a huge problem, guys. We acknowledge that opiates are a big problem, but now we also have, on the other hand, now the issue that while to address this problem, we need to reduce the amount of prescriptions that we're giving for opiates, but then it also may hurt providers, us in the future, financially. Well, how much is it going to hurt you? Well, according to the American Medical Journal of Ethics, 30% of provider reimbursement is directly related to HCAHPS. 30%. Now, I know that we're all possibly hoping to make six figures as a part of being nurse practitioners. We've all worked hard for our education and we like to be compensated fairly. We have a graduate level education, so I don't think that's out of the ordinary to hopefully receive six figures for this type of work and this type of education. So let's say it is. Let's say it's $100,000. Who here would be willing to give up $30,000, 1/3 of their income, in order to help combat this issue? I know that'd be pretty hard for me to swallow. That would be pretty hard for me to give up 1/3 of my income, potentially 1/3 of my income, to help address this issue. So then the question becomes, so how do we effectively address this issue as healthcare providers? Uh, how do we acknowledge that the opiate crisis is a problem? And I'm here to tell you that it is. But then how do we also properly incentivize providers to do the right thing to reduce the amount of opiate prescriptions that they are writing for? Then also tie it back into, okay, patients, this is what we've been mandated to do, so we cannot be impacted financially or professionally because we've been mandated to do so. So let's talk about stakeholders for this issue. There are a lot of stakeholders for this issue. The federal government is number one, guys. The federal government really cares about this issue because the amount of people that are dying daily from this. I told you that 115 people are dying estimated per day as a result of opiate use. Okay, so the federal government cares because their constituents are dying. This relates to healthcare. This relates directly to the healthcare economy and how much money we're losing as a result of having to treat these patients. Lowering the workforce, how much lost revenue is related to people having opiate-related issues. So the federal government really cares about this. Providers are interested in this issue, guys. We are interested in this issue because we all got into this profession to do the best possible thing for our patients, and we know now that that may not be opiates. But we've created a big problem for ourselves, haven't we? Just as providers as a whole. We've been prescribing these medications somewhat flippantly for so long now that we have so many people addicted to them or requiring them, having a physical dependence or tolerance built up to these medications, that now they demand them. It's an expectation. The consumers expect their pain to be treated, and if it is not, then that directly relates to your patient satisfaction scores and your financial bottom line. So providers are very interested in this. Finally, the American public really is interested in this. Is there loved ones who are having these problems as related to opiate issues, including death, lost work, impacted relationships with their loved ones, etc. So moving down, what policies have been proposed to address this issue? I know that removing pain as a fifth vital sign has been proposed to address this issue. I always found it pretty silly as a nurse, and I'm sure you guys all have too, that we can't use our objective criterion to help influence how pain is documented. So we know that blood pressure rises. We know that patients become tachycardic. We know that they become diaphoretic. We know that there are objective signs to patients being in pain. But that is weighed less than a patient saying, I'm an 8 out of 10 pain, which is probably the most common number that we all hear, right? My pain is 8 out of 10. So what has been lobbied in the past here is to remove pain scoring and the perceptions of pain from HCAHPS and from scoring for patients. Now, there are other ways that patients can say if they felt like their health issues were properly addressed, which then could be tied back into pain. But they're trying to remove questions that directly relate to that, because then providers are going to feel that push, that burden to say, we need to address that, because if we don't, my patient satisfaction scores are going to be lower. And this could potentially impact my professional life if my scores are consistently low. I could be fired, I could be reprimanded, I could have issues at work. And then, as I said to you guys before, up to 30% of provider reimbursement is directly tied to patient satisfaction HCAHPS scores. 30%. It's huge, guys. So now, so how do we effectively address this? I think we need to continue on with what we're doing and saying, okay, you know, we all acknowledge that this is an issue. We all acknowledge that this is a problem. However, I don't feel I should be penalized for trying to address the problem effectively and in a way that the American public and our legislators have demanded. So by removing pain as a fifth vital sign, but still finding a way to acknowledge it in a meaningful way because it is important, then also removing the treatment of pain directly from patient satisfaction scores is important. And I think that ultimately that is what's going to help us solve this issue and help us collaborate as providers with the American legislators and the American public to effectively address this problem in a meaningful manner and in a way that everybody benefits and that everyone feels safe by addressing this problem. So, as you can tell, I'm really passionate about this, and I'm sure you guys are too. This has everything to do with how our future is going to go as providers, and if this is going to be a patient, rather, excuse me, if this is going to be a consumer-driven industry where we respond to consumer demand, or if we as professionals are going to have a say in this. If we as professionals, the people who have toiled in front of these computers and in front of our books for so long, are we going to have the ability to have a say in this where we can say, no, according to my training, my experience, my education, this patient was not an 8 out of 10 pain, and therefore I know that the opiate crisis is a huge problem, and so therefore I did not prescribe this patient opiate medications for their pain. I advise alternative or adjunctive therapies, NSAIDs, Tylenol, that sort of thing, for this patient's pain, because I felt to the best of my ability that that would effectively treat the patient's pain. And then people who are deciding how much we should be reimbursed and how much we should be paid can look at that and say, yeah, you're right. You did the best that you could, and we appreciate that. So guys, thank you so much for listening to my video. I really look forward to hearing to your critiques and responses. I'm going to include all of my references at the bottom of this video, just as text links so that you guys can all take a peek at them. I know I didn't really acknowledge too many of them here during this presentation, but all the facts that I said here can be checked on the references that I am going to provide. Thank you so much for listening to this video. I hope that this does spark some interesting debate and maybe raises your awareness of the other side of this issue, which really addresses us as providers. Thank you so much.